In your opinion, what is the deadliest disease today?
Hypertension,
Heart attack,
Cardiovascular disease.
HIV.
Or hypertension.
Have you had your blood pressure measured recently?
Yes, I have.
about a year ago.
I don't think so.
About 2 months.
Yes, I think I had it recently because I gave my blood.
Maybe 3 months ago.
I don't think I had my blood pressure taken ever.
A few months ago.
Not recently.
Hypertension affects more than 1.2 billion people and kills more than 11 million around the world. Hypertension is also called a silent disease because it often has no warning signs or symptoms. 50% of people with hypertension don't know they have it as they do not exhibit signs or symptoms. This is why today, hypertension is considered a global public health issue.
Do you know hypertension? Do you know a bit about this disease?
A little.
Yes, I do, but I'm out of it.
I know a lot about hypertension or blood pressure. I suffer from high blood pressure for a long time.
No, I'm not quite sure about this.
Same, no idea.
That's raised blood pressure, but that's about all I know about it.
Hypertension is linked with blood pressure. Hypertension is defined as blood pressure that is consistently high. Over time and with age, blood pressure rises. The walls of large arteries become more rigid, and the small blood vessels become narrower. Because of these changes, the heart has to generate a greater force to keep blood flowing around the body. This leads to an increase in blood pressure.
What are the symptoms of hypertension according to you?
You can feel a bit dizzy,
red cheek, nervous, stressed.
problems with visions or something like that.
I don't really know the symptoms.
Noise in your ears.
You are pretty tired.
Migraines.
Your heartbeat accelerates.
And then maybe you can have heart attack and stuff like that.
You can have some headaches.
We call hypertension a silent killer disease. Hypertension has, in most cases, no symptoms. It is not something you would notice or feel. The only way to know whether a person has hypertension is by having their blood pressure checked. For these reasons, it is recommended to measure your blood pressure from the age of 40.
Why is it very important to check regularly your blood pressure?
It's a risk factor which you can prevent.
Maybe heart problems or lung problems.
So that you avoid either strokes or a heart attack.
Many diseases can be avoided.
Hypertension is the first risk factor for death because the disease can have serious health consequences. When you have hypertension, your heart has to work harder to ensure the flow of blood around your body. The high blood pressure in your body can gradually weaken your heart and damage artery walls. This situation can increase the risk of developing cardiovascular diseases, such as stroke, heart disease, and heart failure. Other parts of the body, including the kidneys, limbs, and eyes, may also suffer damage. For that very reason, it is recommended to visit a doctor regularly and get your blood pressure checked routinely at least once a year if you are over 40 years of age, or more often if you have high blood pressure.
In your opinion, what can be the causes of hypertension?
So I would say stress or maybe cholesterol,
Stress mainly.
Maybe if you don't exercise a lot, if you're a sedentary.
Eating too much fat, eating too much sugar, not doing any sports, not exercising, even smoking, of course.
In most of the cases, it's really the consequences of a lifestyle.
Unhealthy diets. Smoking probably.
Mostly depending on the parent and grandparent you used to have.
Stress maybe.
It can be hereditary problems.
Mostly the stress, I think.
Drinking too much.
Perhaps no sport, no practice of sport.
There are many factors that increase the risk of developing high blood pressure. Lack of physical activity. Excess weight. Excessive salt intake. Stress. Excessive alcohol intake. Chronic heavy smoking. Heredity, race, or ethnicity can play some role in high blood pressure.
Do you think hypertension can be prevented or avoided?
Avoided? No, I can't see how it can be avoided. So it can be controlled.
Yes, if you eat well, if you eat good products, organic products maybe.
Do some exercise, eat less, stop smoking.
By doing regular tests, like once in a year, maybe. Walking less, less stressful environments.
Sport, healthy diet, and after medication.
By taking some pause, I think.
With good hygiene and with exercise and all, it could be avoided.
You can have a huge influence on reducing your high blood pressure by changing your lifestyle habits and following your doctor's recommendation about the use of medicines. The most important changes that you can make are as follows. Start doing regular physical activity. Try to lose weight. Improve your diet. Relax. Adopt a healthy lifestyle. Take your treatment according to your doctor's recommendation.
Do you think this disease can be cured?
Yes, of course, it can be cured.
I'm going to say no. I think if you have it, it's too late.
Yes, of course, it can be cured.
It can be stopped with drugs, but I don't think it can be cured.
I know it can be cured. There are some medicine.
If there is a cure, I haven't heard of it.
Well, cured, I don't know, but stabilized, yes.
Can it not be cured already?
Hypertension is a chronic disease that can be managed with long-term treatment. Fortunately, there are effective levers to tackle hypertension as follows. An early diagnosis made possible by checking blood pressure regularly. A treatment adapted to the patient's needs, which could encourage better adherence. Supportive information for improving your lifestyle.